Good morning, everyone. Today's research will examine anthrax, which produces severe disease symptoms through Bacillus anthracis bacterial infections. Anthrax represents a critical condition in medical terms and public safety environments because of its biological warfare applications.
Anthrax has existed for numerous thousands of years. The first writings describing diseases similar to anthrax appeared in ancient Egyptian documents combined with entries from Greek scribes. In 1875, Robert Koch scientifically characterized the bacterium after showing evidence of microbial disease association through his work. Human anthrax cases develop from contact with infected animals, their hides, wool, or meat products, and related animal waste. The bacteria typically infects the animals it mainly targets, including cattle, sheep, and goats. The threat of anthrax continues because this bacteria produces hard-to-destroy spores. Bacillus anthracis spores maintain survival capability in soil regions for long periods before environment-friendly conditions enable their activation.
Examining the microbes as an entity forms the basis of this discussion. Bacillus anthracis is a gram-positive, rod-shaped bacterium that can produce highly durable spores. The bacterium produces spores that survive during harsh temperature exposures, exposure to chemicals, and dry conditions, resulting in complicated destruction. The microorganism becomes particularly hazardous because it generates three toxic substances. Protective antigens, edema, and lethal factors combine to depress immune responses so bacteria can distribute themselves more easily while harming tissues for disease progression.
The four distinctive forms of anthrax include cutaneous, inhalation, gastrointestinal, and injection. People usually contract cutaneous anthrax, which is the most frequent form. It begins with an irritating bump and evolves into an ulcerated wound with blackened areas. Inhalation anthrax represents the most dangerous form, which presents with initial flu-like characteristics that quickly transform into a fatal respiratory breakdown. People who eat undercooked meat or consume contaminated products can develop gastrointestinal anthrax because this form of the disease brings severe digestive issues along with nausea, vomiting, and bloody diarrhea. The occurrence of anthrax through injections remains exceptional, and cases mainly target drug consumers exposed to contaminated substances. Medical treatment of this condition remains challenging because it leads to tissue swelling alongside severe deep infections of the body.
Diagnostic assessment of anthrax depends on the specific form that affects a patient. Medical tests for examining anthrax involves blood cultures, PCR examinations, chest X-ray pictures, and samples from dermal infection sites. Early detection is critical. Anthrax treatment becomes successful when doctors begin administration of ciprofloxacin or doxycycline antibiotics shortly after diagnosis. Healthcare providers manage severe inhalation anthrax cases by treating patients with antitoxin agents that block the harmful protein-making process of the bacteria. The available vaccines exist mainly for military forces and researchers handling the microorganism.
The United States annually reports 2 cases of natural anthrax occurrences. Anthrax remains prevalent throughout areas of Africa, Asia, and the Middle East because these regions lack proper systems for vaccine administration to animals and protection of food safety. Laboratory employees, together with animal workers and personnel who handle animal-derived products, represent the groups most likely to develop anthrax infections. A successful recovery from anthrax infections depends on the variety of infections and continued treatment support. Treated early, cutaneous anthrax has more than a 95% chance of survival, but the survival rates for both inhalation and gastrointestinal anthrax reduce significantly if not detected soon enough. Anthrax infection has the potential to develop long-term adverse effects, which could result in scarring together with exhaustion and sometimes organ damage.
Through research, scientists develop rapid testing methods, stronger vaccines, and better methods to stop toxic substances. Research into understanding the molecular processes of disease enable improved preparedness systems that extend beyond natural disease outbreaks into bioterrorism defense. Anthrax became our subject of study due to the essential position between medical infectious threats and national security concerns. Its special biological characteristics, historical patterns, and contemporary importance makes anthrax an important research area for healthcare systems and public security needs.